Half a century after health law was first recognized as a specialty, the opportunities for an attorney in healthcare could now be greater than ever. And the association that helped educate lawyers, helped build their careers, and helped inform public policy is more vital, more vibrant than ever. That is a long way from its humble beginning.
It started out as the Society for Hospital Attorneys.
92-year-old Art Bernstein is one of the association founders. He and a couple of other lawyers pestered the head of the American Hospital Association to let them have a society for attorneys like it had for nurses, pharmacists, and other professionals. But Bernstein says Dr. Edwin Crosby was reluctant.
Because he didn't like lawyers, and he said, we have one lawyer and we don't get sued. Our friends down the street, American Medical Association, they've got half a dozen lawyers and they're getting sued all the time.
Bernstein says about a year later, Dr. Crosby was visiting a new, barely finished Hospital Association office on Farragut Square in Washington.
And a ceiling tile fell and hit him on the head. And it may have been pure coincidence, but that day he told me, okay, create the organization of lawyers.
Bernstein hired David Greenberg to run the society.
We were like a large committee of the Hospital Association.
This came 2 years after President Johnson signed the amendments to the Social Security Act to create the Medicare and Medicaid programs in 1965, the most important milestone in history for American healthcare lawyers.
It transformed the industry. It took a cottage industry and made it into an industry that is today 1/5 of the GDP.
Every year there would be budgetary considerations and changes in policy that we had to learn about as healthcare lawyers.
Those regulations and binders full of changes in the future would mean plenty of work for attorneys who would soon call themselves healthcare lawyers. But where could they learn about it? Books had yet to be written about health law. Law schools had few, if any, courses about it. The society filled that void, holding an annual conference, plus several meetings a year.
People would be able to gather and talk about a very specific topic that they were interested in. So that's what the table topics were at that time.
We were all, to a degree, teaching. The whole thrust and purpose of the American Society was really to co-educate ourselves.
Society membership was restricted, open only to hospital lawyers. When the headquarters moved to Chicago, Greenberg left the society and stayed in D.C. In 1971, he helped start a more open, inclusive, competing organization, the National Health Lawyers Association, open to more than just hospital attorneys. It had a modest beginning.
His apartment was the headquarters of the National Health Lawyers Association. This was back in the late 70s.
Health lawyers began with things like in handout that David published from his living room.
Tom Fox chaired one of NHLA's earliest programs, an annual meeting on long-term care.
We operated based upon David's credit card.
NHLA was small.
It was probably less than maybe 400 lawyers.
One of the founding principles of the National Health Lawyers Association was the willingness of health law practitioners to share their knowledge with everybody, including their competitors, and to help other people move into the field.
In the 60s and 70s, most hospitals were nonprofit.
If they had lawyers, they often didn't have to pay them.
Those attorneys were often on the hospital boards. And when attorneys did charge, it wasn't much.
And we were charging for partners' time was $44 an hour, which was lowball even back in the 70s.
A series of health law milestones would change all of that. 1972 brings a career-changing development for many lawyers when Congress approves Social Security amendments that apply the first federal anti-kickback provisions to Medicare, Medicaid.
All of a sudden, things that were just common, in my opinion, reimbursement disputes, get morphed into maybe allegations of fraudulent activity.
Once they realized they could get treble damages for fraud, and what used to be just truly would be billing errors, they would claim that it would be fraud.
Next, 1973, the Health Maintenance Organization Act promotes the development of HMOs.
When the federal government decided to allow the managed care industry to participate in the Medicare program and then Medicaid. I mean, that was a career-changing moment.
Congress grants greater access to health care in 1986 when it approves EMTALA, the Emergency Medical Treatment and Active Labor Act.
Anybody that came to your emergency room could not be turned away just because of their ability or inability to pay.
Congress approves the first part of Stark, the Physician Self-Referral Law, in 1989, an especially important milestone for lawyers representing physicians and institutional providers.
The fraud and abuse issue was whether or not improper inducements were being provided to get the private pay patients into the nursing home. Why are you paying this prominent physician $150,000 a year to be your medical director?
1996 brings HIPAA, the Health Insurance Portability and Accountability Act, permitting continued health insurance coverage and protecting privacy of health information.
Those concerns still linger today, particularly as privacy becomes much more related to data security.
2010, President Obama signs the landmark Affordable Care Act, enacting major health insurance reforms, mandating health insurance coverage, and expanding Medicaid eligibility.
For health lawyers, I think there's going to continue to be, a steady diet of work.
Healthcare will never be deregulated. It will always be, in my opinion, the most heavily regulated industry.
As health law expanded, the two associations bringing lawyers together in collegial settings to educate one another about all the changes were heading toward a merger. But years before that, they had a joint venture, the Medicare-Medicaid Institute. Greenberg reportedly said it was a chance to see about joining together.
But that wasn't the truth, because he really wanted somebody to share the loss in case it bombed.
And it became the most profitable conference of all conferences for either the NHLA or the Society.
J.D. Epstein of the Society and Len Homer of the NHLA started and chaired the Institute for 21 years. The annual session in Baltimore was a big success, bringing together government lawyers and private practitioners, everyone learning from each other.
The healthcare lawyers, I think, play an important role in helping government leaders understand that healthcare actually is very complicated.
Both associations emphasized a collegial quality that remains a cornerstone of today's American Health Lawyers Association.
The competition for clients was pretty heavy, but when it came time to sitting down in the association, it was really all about how do we best advance the education of our fellow lawyers in a way that makes us all better.
I think the single most important thing the association does is to get people together. It's where you have the preeminent people in the country in a particular area who will come, provide a massive outline, tell you all there is to know about a particular topic.
Members say that taking an active role, networking, volunteering was an investment in both their relationships and their careers.
From that experience, you're able to not just help your existing clients, but develop additional clients and develop a network of attorneys that refer to you because they believe you know what you're doing.
Basically built my career.
1991 brings a change for the National Health Lawyers Association when visionary pioneer David Greenberg retires and Mary Lou King becomes CEO.
She was terrific as well, and she had budgetary issues when she first got here and was disciplined and strong in solving those budgetary issues.
King made key hires and professionalized the NHLA.
One of the first things we did when we got our financial feet on the ground was engage in the first strategic plan. We drafted what is currently the mission statement for the association.
It was very important to me that the word excellence appear in the mission statement of the organization, and it remains still there.
Under King, the association moved into the electronic age.
The first website was created and the first magazine was created. When I first came, we barely had computers on our desks. Email was something new.
AHLA promotes inclusiveness and opportunity. With term limits already imposed on board membership, the association placed sunsets on program chairmanships, to give people from a more diverse range of firms, subspecialties, and parts of the country an opportunity to be leaders.
I think that new blood is important for all organizations, especially with the challenges of the way law practice has changed.
The two associations had different cultures. The society, later renamed the American Academy of Hospital Attorneys, described by members as more social and family-oriented.
We had, at that time, we had a kind of a formal dance on the last night of the program, which was eventually eliminated.
NHLA used to be almost business only.
It was a culture that was open. It valued performance.
Bob Johnson with the Academy was among those instrumental in moving to merge the two associations.
We ask ourselves the question, why are there two organizations that are essentially the same?
At that point, the health law section of the American Bar was also doing the same kind of thing.
There were 3 small associations representing or trying to deliver educational programs and services to health lawyers. This did not make any sense.
But each association had concerns.
You know, would we be able to sustain the values and the quality programming that we had had before?
And how are we going to fit these cultures? And I always thought they're just health lawyers like we were. They just happened to be in another association. Turned out to be actually, I think, a quite smooth process overall.
Yet at the end of the 90s, when Mary Lou King returns to private practice and Peter Leibold takes over as CEO, merging of the two cultures was still underway.
My greatest challenge was to meld the culture of the two predecessor organizations. One was a staff-driven, professionalized organization that Mary Lou had run. The other was a member-driven component of the American Hospital Association without a lot of staff.
He says what emerges is a culture that recognizes member service with a sense of fun.
We have to keep that notion of professional camaraderie in the organization.
One of the things that the Academy introduced to the culture of the NHLA, now the AHLA, was a kind of a more social spin on, there are more cocktail parties, there are more opportunities for people to get together and do things.
The American Health Lawyers Association, like both its predecessor groups, embraces and promotes diversity.
If you want to promote diversity, you really have to reflect it in your leadership.
And I think that sends a very, very strong message that, you know, you can come from any world, any background, and you can become a leader at AHLA.
I think what it really meant was a validation.
The new century confronted the American Health Lawyers Association with tough challenges. First, the 9/11 attacks. Suddenly, people did not want to get on planes to attend in-person conferences.
We had to find new services. We had to find new sources of revenue. We developed these sets of webinars, and those webinars really helped us.
Then came the Great Recession and its financial challenges.
We reduced expenses. We diversify our revenue sources. We make greater claims on one revenue source over another.
The association found a way to survive those tough times and to thrive, expanding services, growing membership. Along the way, the AHLA also found ways to give back to society through public interest activities.
We developed a brochure on living wills.
2015, the AHLA board works on a school in New Orleans. That's where the board's first pro bono work took place in 2009. Painting, planting, making repairs still necessary after Hurricane Katrina.
And one of the things we do every year is to do a service project, able to give back in the community.
David Cade, an AHLA board member and former Deputy General Counsel of the U.S. Department of Health and Human Services, became the association's CEO in 2015.
I'm constantly looking for ways to not only broaden the reach of AHLA, but to do it in a way that has purpose, to do it in a way that continues to educate the community, to bring the community together, and to continue that kind of special relationship that we've had in the health law bar that started 50 years ago.
Now that baby boomers are the main consumers of health care, and with Congress adding and changing laws, haggling over what to do about the Affordable Care Act, and the Supreme Court handing down opinions on health law challenges, the future for healthcare attorneys looks bright.
Healthcare represents about 20% of our economy. It's never going to go away, for better or for worse.
So as the American Health Lawyers Association looks ahead to a new dawn of opportunity and challenge, its mission seems more critical, more necessary than ever.
I think the challenges it faces in the future is keeping up with change.
As it enters its second half century, AHLA remains devoted to its culture, its historic traditions, and its enduring values: excellence in education, inclusiveness, collegiality, and nonpartisanship. Empowered by a spirit of collaboration, the American Health Lawyers Association fosters a culture where competitors learn from one another, create networking opportunities, invest in relationships, build better careers, and help shape health law in America.